Contagious Caprine Pleuropneumonia. Contagious Caprine Pleuropneumonia, or CCPP, is one of the most severe respiratory diseases of goats. Asia and Africa have large goat populations of 550 and approximately 400 million goats respectively. Goats are important to the farmer as they provide meat, milk, skin, fiber, and live animals. There are huge losses annually amounting to $500 million due to high mortalities and reduced milk and meat yield due to disease, and due to the cost of treatment and the measures for control, diagnosis, and surveillance of CCPP. There are also indirect losses in the form of trade restrictions on import and export of goats. Etiology. The causative agent of CCPP is Mycoplasma capricolum subspecies Capripneumoniae. The mycoplasma represent the smallest self-replicating organisms which lack a cell wall. These organisms are fastidious and they are difficult to grow in artificial culture media. Mycoplasma capricolum subspecies Capripneumoniae is closely related to Mycoplasma capricolum subspecies Capricolum, but more distantly related to the other members of the Mycoplasma mycoides cluster. CCPP disease is confined to the thoracic cavity, whereas disease caused by other mycoplasmas of the mycoides cluster is accompanied by prominent lesions in other organs or parts of the body, causing syndromes such as mastitis or keratitis. The causative organism of CCPP is formally known as Mycoplasma species type F38, which was first isolated in Kenya. Phylogenetic studies have clustered Mycoplasma capricolum subspecies Capripneumoniae isolates into major groups correlated with different geographic regions, including Africa, Asia, Arabian Peninsula, and the Mediterranean basin. CCPP occurs in many countries in Africa and the Middle East, and the distribution is thought to extend to Asian countries. Mycoplasma capricolum subspecies Capripneumoniae was first isolated in Kenya in 1976 and subsequently in other African countries and in the Arabian Peninsula. CCPP was first reported in Europe in 2004 when outbreaks were confirmed in the Thrace region of Turkey with high mortality of 25% in some herds. CCPP is often confused with other respiratory infections such as pasteurellosis due to the difficulty in growing this organism in the lab. From a historical perspective, CCPP was first reported in Northern Africa in 1873 before moving on to other parts of Africa, the Arabian Peninsula, and possibly Asia. Clinical cases of CCPP have been reported in approximately 40 countries, although the causative organism has only been isolated in 18 countries. The geographical distribution of CCPP can be seen extending from East and North Africa through the Arabian Peninsula to Asia, whereas in Asia, most confirmed cases are in wild ruminants. The OIE map of reported CCPP outbreaks shows similar geographical distribution. The domestic and wild ruminant hosts of Mycoplasma capricolum subspecies Capripneumoniae are as shown, and they include sheep, cattle, goats, and the Laristan mouflon, Tibetan antelope, the Nubian ibex, just to mention a few. Goats are the primary host of Mycoplasma capricolum subspecies Capripneumoniae. Sheep may be affected in CCPP outbreaks in mixed goat and sheep herds. However, Mycoplasma capricolum subspecies Capripneumoniae has also been isolated from healthy sheep, and this shows its possible role as a reservoir which must be considered. CCPP was confirmed in wild ruminants kept in a wildlife preserve in Qatar, and the disease affected wild goats, Nubian ibex, Laristan mouflon, and Gerenuk, with significant morbidity and mortality in these species. Epidemiology. CCPP is one of the most severe diseases of goats affecting the respiratory tract, and it is extremely contagious and frequently fatal. The morbidity rate may reach 100% and the mortality rate can be as high as 80%. Major economic losses are experienced with CCPP in East Africa and the Middle East, where the disease is endemic. During the only confirmed outbreak in wild ruminants, the morbidity rate was 100% in wild goats and 83% in Nubian ibex. The mortality rates in these two species were 82% and 58% respectively. CCPP is contagious. An infection is transmitted during close contact by the inhalation of respiratory droplets. Chronic carriers may exist, but this remains unproven. Some outbreaks have occurred in endemic areas when apparently healthy goats were introduced into naive flocks. Outbreaks of the disease often occur after a stressful event such as heavy rains, cold spells, or transportation over long distances. This may be because recovered carrier animals shed the infectious agent after the stress of sudden climatic or environmental changes. Close contact of animals at a watering hole presents a risk for transmission. Other factors making animals more susceptible to CCPP infection are malnutrition, long-distance movement, young animals show higher mortality, chronic carriers, and concurrent diseases. The incubation period of CCPP under natural conditions is 6 to 10 days, but may be up to 3 to 4 weeks. CCPP should be suspected in goats when a highly contagious disease occurs that is characterized by pyrexia of 41 degrees Celsius or higher, severe respiratory distress, high morbidity and high mortality, and when postmortem lesions of fibrinous pleuropneumonia with pronounced hepatization and pleural adhesions are seen. Clinical symptoms. In naive populations, morbidity can reach 80 to 100% and mortality 60 to 80%. CCPP is strictly a respiratory disease. Hyperacute, acute, and chronic clinical forms occur in endemic areas. Goats are mainly affected, although captive wild goats, Nubian ibex, Laristan mouflon, and Gerenuk are also reported to be affected. Hyperacute affected goats may die within 1 to 3 days, showing minimal clinical signs. In the acute form, initial signs are high fever of 41 to 43 degrees Celsius, lethargy, and anorexia. This is usually followed within 2 to 3 days by coughing and labored respiration. In the final stages of acute disease, the goat may not be able to move and stands with its front legs wide apart and its neck stiff and extended. Saliva can drip continuously from the mouth and the animal may grunt or bleat in pain. Frothy nasal discharge and stringy saliva may be seen in the terminal stages, and pregnant goats can abort. Acutely affected goats generally die within 7 to 10 days. In the chronic form of CCPP, there is a nagging cough, nasal discharge, and debilitation. CCPP is exclusively a disease of the respiratory tract. Lesions of acute disease are characterized by unilateral pneumonia, serofibrinous pleuritis with straw-colored fluid in the thorax. The cut surface of the lung is granular with copious straw-colored exudates. Pea-sized yellow nodules may be found in the lungs, and varying degrees of lung consolidation or necrosis can be seen with enlargement of regional bronchial lymph nodes. The lesions of acute CCPP, as seen in the illustration, are often unilateral, affecting the lungs and the pleura only. In this illustration, we see fibrinous pleuropneumonia with the distinctive omelette characteristics. Once again, fibrinous pleuropneumonia is seen. Here, an illustration of fibrinous pleuropneumonia with pleural fluid is seen. Once again, an illustration of fibrinous pleuropneumonia with pleural fluid. Once more, an acute lesion showing fibrinous pleuropneumonia. A lesion of fibrinous pneumonia with no significant involvement of the pleura is presented. Substantial amounts of fibrinous pleural fluid can be retrieved from acutely infected animals. The granular appearance of the lung can be appreciated in the cross-section of the fibrinous pneumonia lesion. Another example of the cross-section of a fibrinous pneumonia lesion. A fibrinous pneumonia lesion showing signs of necrosis. Enlarged thoracic lymph nodes can also be seen. Chronic lesions of CCPP include adhesions to chest walls, encapsulation of acute lesions forming sequestra, and the appearance of necrotic areas. In chronic CCPP, long-term survivors may develop chronic pleuropneumonia or chronic pleuritis with possible encapsulation of acute lesions with or without pleural adhesions to the chest wall. The interlobular septa are not thickened in domesticated goats. However, in wild ruminants, CCPP may have similar lesions, but with thickening of the interlobular septa, which has been reported in some animals. Chronic pleuritis showing widespread fibrin deposit on the pleural cavity. An illustration of pleural adhesions in a chronic case of CCPP. A small sequestrum in a chronic lesion of CCPP. Necrotic areas in the form of sequestra can be seen in this chronic lesion. Just to recap, Mycoplasma capricornum subspecies Caprine pneumonia is readily contagious and fatal to susceptible goats of all ages and both sexes. It rarely affects sheep and does not affect cattle. The differential diagnoses for CCPP are peste de petit ruminant or PPR, pasteurellosis manheimiasis, contagious agalactia syndrome, also known as mastitis, arthritis, keratitis, pneumonia, and septicemia syndrome. Manheimiasis and mycoplasmosis co-infection showing the bilateral lesion of the lungs. Mycoplasma pneumonia showing a bilateral lesion of fibrinous pleuropneumonia. Bilateral pneumonia in a lesion of Mycoplasma pneumoniae. Ovine pulmonary adenomatosis or MIDI-VISNA showing a bilateral nodular pneumonia lesion. Nasal discharge due to lungworm infection can also be mistaken for CCPP. Lungworms are visible on the hyperemic mucosal surface of the trachea on postmortem. Estrus ovis infection can also cause similar clinical signs to CCPP. Mycoplasma mycoides subspecies Capri will show lesions in the lungs as well as in other parts of the body such as arthritis. The presumptive diagnosis of CCPP is based on field observations of clinical signs and on postmortem examination. Laboratory confirmation relies on culture and isolation from clinical samples of lung, lymph nodes, or pleural fluid. However, this is often difficult. Molecular diagnosis is based on PCR, real-time PCR, and the recombinase polymerase amplification assay. Serological diagnosis is based on the complement fixation test, the latex agglutination test, and the C-ELISA. The control and eradication of CCPP relies on quarantine, live animal import restrictions, movement control, and test and slaughter of infected animals. Antibiotics can be applied such as macrolides, tetracyclines, streptomycin, and venlafaxine, which can be effective if given early. There is vaccination available for CCPP. CCPP vaccine is available in lyophilized form and has a shelf life of at least 14 months. Revaccination is required after every 6 months because of the limited period of protection of the vaccine under field conditions. Thank you for your attention.